Welcome, it's Time Warner Cable's Local Edition. I'm Brad Pomerance. We are joined by Kim Milstien. She is the new president and CEO of Simi Valley Hospital. We congratulate you.
Thank you.
Tell us about your new job, how this happened.
Oh, it's been great. I've been with Adventist Health for 16 years. Adventist Health has 20 hospitals in the western United States, and Simi Valley Hospital is one of them.
Right.
So I most recently was at Glendale Adventist Medical Center.
Which is right off the freeway. We see it as we're driving by.
Yeah. And so earlier this year, I got a call that, one of those calls that you always think may come, and
it came.
You're very surprised when it does.
And we congratulate you.
Thank you.
Tell us about Simi Valley Hospital.
Simi Valley Hospital is a great hospital. We've been in that community since 1965, started by doctors who recognized that this community was growing.
Oh,
and
yes, it was.
Absolutely, deserved to have a hospital to care for the residents of the community. So,
and it has about 120 beds, is that right?
144.
Okay.
All private.
Which is very nice.
Which is lovely, yes.
And what's nice about the hospital is you are expanding. I mean, you're not a sleepy institution. Nope. You're looking to really become even a more premier hospital. So tell us about some of your expansion efforts.
Absolutely. Well, I think the most obvious one is the entire building was rebuilt. In 2008, we opened our new patient care tower. It's a 3-story tower with 144 private rooms, motel rooms, hotel rooms. They're beautiful.
Which is nice.
Very, very nice. And a new lobby, a lot of new amenities for the patients as well as new services. We're currently in the process of building a cath lab, a cardiac catheterization laboratory, which means that we can develop a very comprehensive heart program. As you know, heart disease is the #1 killer of men and women in this country, and we feel it very much our responsibility to make sure that we're caring for the residents of our communities right here in the community.
Right, and talk to us about your women's health division, because I understand it's a fairly strong one.
Absolutely. We have labor and delivery as well as a neonatal intensive care unit. So as we know, the age of moms is aging. We're seeing a lot more older moms, myself included.
Oh, wow.
And with that comes potential complications with the delivery process, and so we're pleased to offer a NICU to our community, to our tiniest residents, to make sure we're taking care of them.
What about your emergency department? Is that slated for growth?
It is. If you've been in our emergency department, it's been a relatively small place that's done amazing things. Last week we broke ground on a major building project that will be completed within the next 18 months to double the size and double the bed capacity. The emergency
of the ER department.
The ER,
right.
Yeah. It's the last piece of the hospital to be completely modernized, so I'm so excited for that. We are doing it without being down in services for even a minute.
Wow.
Kind of like changing the airplane, the engine on an airplane
in
mid-flight.
Now my question is, how are you able to do all this expansion in light of the fact these are tough economic times?
Absolutely.
Healthcare costs, we know, continue to rise beyond inflation. What's going right for Simi Valley Hospital?
I think the biggest thing that we have is the strength of Adventist Health. We are a not-for-profit, community-based system. So the the nuns used to say when they had the Catholic hospitals that not-for-profit doesn't mean no profit, no money, no mission. So while we do make sure that we are a viable organization, the money that we make on our operations goes back into the community. So that's what you see evidenced by the brand new building, by the new emergency room, by the cath lab that's coming. It's our commitment to make sure that we're taking care.
And tell us about the Adventist system. I mean, it is, we think about Catholic hospitals, they're very well known. Adventist, tell us more about it.
The Adventist health system is based on the concept of whole person care. So while of course we care for the sick and the vulnerable like every other hospital in the nation, we really are focused on whole person care, which means that we don't care just for your physical being. So we would never say, Brad with the hip in room 14.
Right. It's
really about the whole person of you. We also firmly believe in community care. So where you hear in the Accountable Care Act, for example, a lot of talk about population health, that's something that Adventist Health Care has believed in for a long time. We believe that we can better impact our community by helping them to be healthier.
Simi Valley Hospital is very lucky. And I congratulate you.
Thank
My
you.
name is Brad Pomerance. Thank you so much for watching Time Warner Cable's Local Edition.